And good morning. I'm Dr. Deuk. It is April 15, 2025. Our patient travels from Georgia with a piriformis muscle syndrome on the right side. This is a torn muscle in the buttock, deep in the buttock, and it creates excruciating pain in the top of the butt cheek or lower back and sciatic symptoms down the leg, because the sciatic nerve always runs next to the muscle or through the muscle that's torn, right where it's torn. Now, when you tear a muscle, the first thing it does is swell up. It gets big. And if the sciatic nerve is next to it, well, guess what? It's going to pinch the sciatic nerve. Try to get a little lower. So, torn muscle never heals on its own. If you take it easy, thank you, Luis, it might get a little better, but then it's going to tear again. It's going to get inflamed again. It's going to cause horrible lower back pain and leg symptoms, like sciatic pain down the leg. So the best thing to do is get it fixed. The only way to fix this is a piriformis muscle release at Deuk Spine Institute. Why at Deuk Spine Institute? Because other doctors do piriformis release, but they do it in a way that's old-fashioned and it doesn't work. It causes horrible scarring, a horrible disfigurement of your butt. Your butt will get sunken in and atrophied. You'll get weakness in your butt and your hip. It'll change the way you walk in a bad way. It'll change the way you run. With Deuk Spine Institute, I pioneered a minimally invasive piriformis release, the first in the world, and it's patented here at Deuk Spine. We actually have a patent for it. So it's the first time it's ever been done, and it works 100% of the time. Okay? And we have minimal bleeding. Now, you are going to be sore for a few days afterwards in your butt. That's normal. But the open surgery, A, doesn't work 50% of the time, and B, is horribly disfiguring and has bad complications. So this procedure at least works. You are going to have a little discomfort for a few days, but that's okay. It's a small price to pay for having a cure to your back and buttock pain. Now, yeah, she's like, loves to bleed. She's, for some reason, maybe she's been on blood thinners or something in the past, but she's oozing a little more than we normally see. I think we're okay now, Dr. Berndes. It seems to be getting better once we got the blood pressure down a little. You're still putting pressure? Good. All right, we're going to show you how a piriformis syndrome occurs and how we fix it here at Deuk Spine. Henry, you want to run the video?
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. We are in the process of releasing her piriformis. You can actually, my God, it's tight, the fibers. So what happens is when you tear that muscle by bending over and twisting, it never heals, but it gets scar tissue developed in the middle after years of pain and inflammation. And you can feel the scar tissue as we do the release. All right, Sean, Okay, perfect. So take a look. There's the greater trochanter. Please put your arrow on that. Uh-huh. No, 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 no. No, go to the left. Left, left. Up, up, up. Right. Oh boy. Right there. That bone right there. That's where the piriformis attaches. That's where the tip of my probe is. So we're releasing it off of there. And I've got about 90% of it done. There's a little bit left. Man. Yeah. Did you feel it? And Nikki is like an expert at feeling it now. All right. Any questions? Sean?
Yes, we have a question coming from Ramazan on YouTube
Yes, Ramazan.
saying, "Hi, Dr. Duke.
Hi.
In cervical disc degeneration, ACDF uses metal fusion, which no one wants. How does your laser treatment work instead? Thank you."
Yeah, great question. A little off topic, but welcome and happy to answer. So, we're going to show you this answer to this question. He's talking about a problem in the neck, which we're not doing in this patient, but we might as well answer it. When you have a problem in your spine with the disc, which is the most common problem by far, 90% of neck pain and arm symptoms are due to a disc problem. We call it a herniated disc or degenerated disc. Either way, it doesn't matter. Disc problem, we'll call it. Okay, disc problem. You can see how small the incision is. In the Deuk laser disc repair we did earlier is 7 or 8 millimeters, and then the Deuk Piriformis release is 5 millimeters. So these are tiny incisions. Everything went great for her. Let me just answer, but Henry, take it off this because we're going to take the drapes down. We're done.
Copy that.
So switch over to something like the X-ray.
Copy that. No, I pushed the camera up. We're all good.
All right. So the only thing that really happens in the cervical spine or neck is a herniated disc and facet joint pain. Now, herniated disc is the cause of problems 90% of the time. Facet joints are the cause of problems 10% of the time. So let's focus on the herniated disc. What is it? The disc is a cushion between bones. It has a wall called the annulus. It has a jelly center called the nucleus. You get a tear in the wall in the back of the disc called the posterior annular tear. The jelly from the center is crushed during the trauma of the tear, and it also pushes out little fragments out through the tear. They get stuck in the tear and cause neck pain, and they go beyond the tear and cause spinal cord compression or nerve compression and symptoms or irritation. So with an ACDF, the surgeon goes in, and to get to the part in the back of the disc where the tear is and the herniation is, they have to remove the whole front of your disc. All of your disc must be removed to get to the back. With our procedure, we leave the front of your disc alone. We go through it using a small tube. It's a jelly. And then we end up at the tip of the tube in the back of your disc where the herniation and tear is, and I use a laser to remove the pieces of herniation and clean the tear so that the tear will heal. And then your disc seals, and basically you have no metal, no plastic, nothing is unnatural put in there. We just get the herniation out and clean the tear with a laser. With fusion, they take the whole disc out and to get to the herniation in the back, and most doctors can't even get to the herniation, so they just leave the herniation in the back and they do a fusion. They put a cage in between the bones where the disc used to be that they took out, and they put a metal plate to hold bones together so that the bones fuse together. It's a horrible procedure. It's going to be replaced in the future around the world with the Deuk laser disc repair, what we're doing here today. We've been doing the Deuk laser disc repair for 20 years, and basically that's the Deuk laser disc repair will replace all fusions except for a very few that are due to fracture dislocations from high-speed trauma. All right, Henry, show them the cervical Deuk laser disc repair.
Copy that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 millimeter skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deuk.com.